2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Ant2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome, South Florida, and welcome all our listeners. First of all, before we start, I want to wish everyone a happy holiday, happy Hanukkah, and please stay safe. We have a great guest tonight. We have Michael Kenya. Hi, Michael. How are you tonight?
I'm great. Thank you for having me.
Michael, you were on once before. We loved having you. I'm glad you're back again. Tell us what you did and what you do. Michael's a specialist. He's an orthopedic surgeon, and he's also does sports medicine. Michael, what is sports medicine, and how does it relate to orthopedic surgery?
So sports medicine is a small branch of orthopedic surgery, mostly concerned with soft tissue injuries. It doesn't have to happen in the course of a sporting event or on a playing field to count as sports medicine. It's any injury to a ligament, a tendon, any sort of muscle injury, any soft tissue injury throughout the body, especially concerning the joints.
Well, I played a lot of sports, and I probably had a lot of sports injuries. But the question is, some of these injuries that occur don't necessarily always have to take surgery. Do they always need surgery, Doc? Can they be treated sometimes without surgery?
Most of the time without surgery. The vast majority of injuries can be treated without surgery, whether it's just with a change in someone's habits, whether it's a stretching program, a strengthening program, sometimes just a simple medication, or sometimes even something a little bit more invasive like an injection is needed.
No.
But the vast majority of injuries that people have, we can treat them without any necessary surgery.
How long have you been in South Florida now, Doctor?
Just over 2 years.
2 years. And you get an office, I understand, one in Boca, and you have one in Boca still and one in Fort Lauderdale, or just Fort Lauderdale now?
It's just Fort Lauderdale now.
And could you tell us what's your phone number in Fort Lauderdale? How can they reach you?
Sure. So the easiest way is just calling over the phone at 954-486-4045.
Well, you can see this is a handsome young doctor, and he's treating orthopedics. He does orthopedic surgery, sports medicine. One of the things that people sometimes get confused with, and I understand, sometimes they have arthritis. Like the doctor said, I had arthritis in my knee. Can you explain how arthritis gets in the knee and what is the treatment for arthritis? And they say, oh, I need a new knee or I need a new hip. And when do you determine when they need a new knee and when they need a new hip? If that's a fair question.
Well, here, I'll start at the end. Yeah, I'll start at the end and get back to the beginning of the question. Generally, when people need a new hip or need a new knee is when they tell us that they need a new hip or they need a new knee. We want arthritis to be present. We don't just want to be replacing people's hips and knees without having any arthritis or any damage to them. But when arthritis is present, usually the treatment or the last treatment is a joint replacement. But it's not based upon x-rays. They help us diagnose it. But the real need is when someone says, I can't live like this anymore. I don't want to live like this anymore. When you have more bad days than good days, when you're in pain more of the time than you're not in pain, when you've tried other things to try to get better, such as taking medications or injections, wearing a brace, or even using something like a cane or a walker, and you're still in pain, that's when someone needs a knee replacement or a hip replacement. In terms of arthritis, I like to compare it to a tire. We're all born with brand new set of tires. Over time, they tend to wear out. They tend to wear out in different people at different times. Car tires wear out differently based upon how fast you drive, how much you drive, how long you drive, what type of roads you're driving on. And it's the same thing for humans. Sometimes they wear out in our 30s or 40s, and sometimes they never wear out during the course of someone's life. But when your tires are bald, we replace them. And that's what I think of as arthritis. Basically, it's the wearing out of the cartilage at the end of the bones. When it's worn just a little bit, we can treat that more symptomatically or sometimes with smaller surgeries. But when it's completely bare, there's not much we can do besides replace it.
Doc, let me ask you a question. What are some of the treatments of replacing a new knee? How is that done? Like a lot of people say, well, I got to get a new knee. Well, what do you mean I'm getting a new knee? What does a new knee mean?
Right, so everyone knows someone who's had a knee replacement, but not everyone knows exactly what was done. During the course of the operation, an incision's made over the front of the knee, and the best way to describe it is the bone ends are cut to resurface them. So how we do that is we generally use a metal implant with a little bit of cement in order to secure it to the end of the bone, and then we replace the cartilage and the meniscus, sort of the soft tissues of the knee, with a plastic insert. So it's two pieces of metal sandwiched between a piece of plastic.
So when that knee is replaced, how long is usually, because I had friends getting knees done, as one said, oh, I was up walking the next day, and I was playing golf in 2 days or 3 days. How long, and usually what is the healing time, or what does the person have to do to get that knee where he thinks it's going to be stable again and normal again? How long does it usually take?
Well, that's a little bit of a loaded question, but at the beginning, after having a knee replacement, we usually have patients up and walking that same day. Now, that's usually with the assistance of a walker and having a physical therapist right near you in order to help you through the process. But people have been getting out of the hospital a lot sooner and a lot more efficiently as we've gotten better at doing this operation and as we've gotten better at managing pain and expectations afterwards. A long time ago, people would come into the hospital sometimes a week or longer before this operation and stay throughout the course of their rehab, which was 4 weeks or 6 weeks. Now we have people come in the same day, and sometimes people are out within a day or two from the hospital after an operation like this.
Amazing.
Generally, it requires some physical therapy afterwards to get better, generally over the course of several weeks. But people are up and walking pretty soon after the operation.
Can that therapy be done at home or mostly at a rehab center? Do they go to rehab?
More and more it's being done. More and more it's being done at home. Before, most people went to rehabilitation centers, but as long as people have someone else in that home that can help them get food, help them up and get to the bathroom, a physical therapist is able to come into the house, and now most of the therapy is done at home when we reserve rehabilitation centers for people who just don't have anyone to take care of them after the operation.
That's where we come in, All County Healthcare. We come in and try to help you at home with our physical therapy. And we have our rate is pretty good as far as success rate. So what's one of the things, I'm putting a plug in for All County right now, Doc, because when a patient gets a knee replacement, home care is their choice and they can choose whoever they want. But you also do hips, correct? Hip surgery too? Do you do
Yes,
hips,
sir.
Doc? And what's the difference, and how bad is a hip surgery in comparison healing time between a hip and a knee? Does the hip take a little longer to heal?
It actually takes a little bit shorter. People usually do a lot better with hip recovery than knee recovery, believe it or not. Generally, hips, people are in a lot of pain beforehand, and afterwards they wind up getting up and moving a lot quicker than knees.
Yeah, I had a friend of mine who just had hip surgery done shortly, and within 3 weeks he was out playing golf again. He said he did all the exercise at home, did everything at home. He was out hitting golf balls, just chipping and putting for a while, and then started playing golf full time. Now he realized his other hip has got to be done, so he's having another hip that has to be done. One hip went, now the second hip's got to go. The other thing I want to talk to you about, what are some of the common tendon ligament injuries? Like a certain shoulder injury, Achilles injury. What are some of the ligament injuries that you specialize in, that you see a lot of today?
Oh, we see a lot of everywhere throughout the body. Yep, rotator cuffs are a very common tendon injury that we see, whether it's just a tendonitis or even something as bad as a rotator cuff tear. We see a lot of tennis elbow recently, where people are just out playing a little bit more and being a little bit more active. and then a lot of knee ligament injuries, including ACLs.
A friend of mine, again, not a friend of mine, complained about a shoulder injury. And he's thinking of getting a new shoulder replacement. Versus, he's had a number of cortisone shots. And he says it works for a while, it's not working. So the answer is, eventually, as you said earlier, it's like an automobile. Long enough, the parts wear out. So eventually, you need some of these things done. So in a shoulder injury, what is a procedure for shoulder injury? Sometimes that takes a little longer to heal. Am I correct?
You are correct with that, especially when we do a shoulder scope or a shoulder arthroscopy, such as for a rotator cuff tear. We need these things to heal. The great thing about doing a replacement, especially in the knee or the hip, is that a lot of times there doesn't need to be a lot of healing because we're healing it with either compression of the implants into the bone or with a cement to hold it in place. When we do something like a rotator cuff tear, we need to give time for the body to heal the tendon injury naturally. We help it, we put it back in the right place, but we still need the body's healing response and natural biology to help everything heal. And with the shoulder, that after a shoulder arthroscopy or a rotator cuff tear, the real healing time is probably in the 4 to 6 month range. Now we progress people throughout that time and we let them move and we let them go to therapy, but till it's back to normal is probably 4 to 6 months for those.
And what's the difference between arthroplasty, if I'm correcting it right, and arthroscopy? Whatever. Am I saying it right?
Yes. So an arthroscopy is when we use a camera operation. So we use multiple small incisions in order to do the procedure. And it's done with a very small camera that are now in HD and even 4K that allow us beautiful visualization of a person's joint. An arthroplasty is a replacement operation. So a knee replacement, a hip replacement, or even a shoulder replacement, like you said your friend was thinking about having.
Doc, we're going to take a little 30-second break. We'll be right back.
Okay.
Are we ready for that break? I think we're ready for
All
that
County
break.
Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. All our listeners. Now, back to our show.
Welcome back, Dr. Kenya. And I just want to repeat your phone number, if I may. I think your phone number in Fort Lauderdale is 954-486-4045. Is that one of the?
Correct.
That's 954, folks, 486-4045. And your office is located, is it 2307 West Broward Boulevard? Or is it?
Yep, it's right off right off 95, right on the West Broward exit.
West Broward Boulevard, correct? And you're affiliated
Yes.
with one of the tenant hospitals?
Yes, with Florida Medical Center and West Coast Medical Center.
Florida Medical, we have a good relationship with Florida Medical Center. It's a great hospital, a great cardiac, great orthopedic hospital. Doc, why did you ever become an orthopedic surgeon? I mean, you should
That's
be
a
in
great
movies,
question.
but why did you become an orthopedic surgeon?
Well, by the time I was 18, I had a shoulder scope on both shoulders, and I loved the sciences, and I really loved my surgeon at the time, and really loved the fact that he got me back to my sport, got me moving again, got me nice back and healthy and doing things like a normal 18-year-old should be doing. And I wanted to explore that and pass that along to other people and be able to give them that.
Well, that's a great story. So you were influenced by your own orthopedic surgeon, by your own surgeon.
Yeah.
Well, that's a great story.
Well, growing up, Growing up, one of my coaches was an orthopedic surgeon for baseball and football, and he was a great guy.
You talk, yeah, but you talk about baseball. I always hear this Tommy John disease. I mean, pitchers get this Tommy John. What is it? What's Tommy John? I mean, that sounds like a name of somebody, but what do they mean by Tommy John?
So Tommy John was a pitcher, and he was the first person to really get this surgery and recover well from it. It's a surgery where one of the ligaments of the elbow on the inside of the elbow becomes stretched and eventually torn. It's the most common in pitchers. If I did it, I probably wouldn't even realize it, but someone who's turning their arm and throwing a fastball over 100 miles an hour, it makes a real difference. It can also be associated with some nerve damage on the inside of the elbow as well. And in order to pitch again, it needs to be repaired or corrected. And the surgical recovery time is the thing that most people realize when they hear a pitcher having it. It's a devastating injury when they're out for over a year, even up to 18 months.
Well, I never knew that. So Tommy John was the first pitcher to ever get the treatment done so he could come back. Because if he doesn't get it done, it's basically the end of his career.
Correct. It was a career-ending injury before that, and like a lot of things, like ACLs and football players in the 70s used to be career-ending, or at best career-threatening, and now you see guys come back and lead the league in rushing, lead the league in receiving, or become future Hall of Famers even after having their ACL reconstructed. Much the same with Tommy John surgery.
I hear that all the time with football players and athletes, basketball players, torn ACL. What do you mean a torn ACL? Where's the ACL located?
So it's one of the four major ligaments of the knee, and it's one that prevents our knee from shifting on us. It's very important during cutting or pitting activities, where it stabilizes our knee so that it's just not moving in space when we're doing those activities.
And what's it stand for, ACL? Achilles?
Stands for anterior cruciate ligament. We have two cruciate ligaments that cross from cross, and so there's the anterior and the posterior because we're not very fancy in any sense.
Folks, you got some great trivia questions here. Who was the first one to get Tommy John disease fixed? Was Tommy John, right? And now you know what Achilles, when they say I got Achilles tendon to you. So we know what that is too. So the answer is you do basically all kinds of orthopedic surgery. I mean, you specialize in all these fields between hips, knees. Also, you don't do surgery, you do repair, right? Kind of repair. If it's a tendon repair, you don't necessarily have to do surgery all the time. Am I correct?
That is correct. We're finding out that we can treat a lot of tendon tears or ligament tears without surgery. I know we talked about before about Achilles tears, and there's a lot more research being done on treating these non-operatively, especially in Europe, but it's starting to come over to the United States as well, where we always treated these with an operation, and now that might not necessarily need to be the case in every patient.
I was playing golf, and I had two torn, what do they call that, meniscus. Now, two torn meniscus. And everybody says, oh, you got to get a surgery. How do you, I'm going through a treatment right now. I taking the cortisone shots on both knees, and now they're giving me this gel shots. Do you have the 3 gel shots for meniscus?
Oh, yeah.
I mean, does a meniscus always have to be, you always have to be operated on a meniscus, or does that create a new knee right? Because my knees go, and I got a torn meniscus. Did that mean I need a new knee, or I need a new meniscus? What do I need? So, very loaded question. A torn meniscus, even 20 years ago, almost meant automatic surgery just to clean it up, to do an arthroscopy or arthroscopy where we make small incisions and trim up the tear. What we found is that it depends on how much arthritis a person has, and it depends on what the meniscal tear looks like. If someone has a great deal of arthritis, we usually treat it non-operatively with injections, and then operatively more so with knee replacement than with a small camera operation. What we found is that if we do a meniscal operation on someone with advanced arthritis, they still have arthritis pain afterwards. So the number of arthroscopies that are being done for these throughout the country are getting less and less every year. Now, if you don't have a lot of arthritis in your knee, sometimes these wind up having surgeries for them, especially depending upon the type, the location, and how symptomatic they are.
but there are multiple other treatment options such as injections, even the gel injections that you're having done.
You know what I'm finding? Let me ask you this question for my own personal use and everybody, as a person my age and older, young people. How important is the need to be in balancing? I mean, I find sometimes when you have knee problems, sometimes your balancing isn't there like it should be. Is that true with knees?
That's 100% correct. The thigh muscles have a great impact on how we walk, how we stand, our gait, and our balance. The knees obviously connect through those. So anytime people have knee pain, they may hold their knees in a different position. It may be painful to stand on them for a long period of time, and they may be shifting around or trying to put less weight on them in order to have decreased pain. But that can also lead to instability and balance problems and even falls, which is a really bad epidemic, especially as we get older and our bones get more brittle, which can result in fractures.
You know, I love to play golf, and I find myself when I'm on a level surface, there's no problem. But when I have to go down an incline or an up climb, there's a problem because of my meniscus.
Yeah,
Is that
and
true?
a lot of times, and I don't know if you've noticed this, a lot of times turning or quickly changing direction can be very painful too. A lot of times my patients tell me getting up from a golf cart and having to turn right there is the most painful part, besides their swing of playing golf.
So, guys, if you're playing golf and the game's not so good, have your knees checked. See this young doctor; he's fantastic. Go to if you need any kind of opinion. I think he's open to give you an opinion on him. Go in and see him. Don't forget, he's located again, if I'm correct, Doctor, 2307 West Broward Boulevard.
Yes, sir.
And he's right off of, and he's part of the Florida Medical Center. He can be located through Florida Medical Center. His phone number is 954-486-4045, right? And I tell you, what he's telling me about sounds like I better go see him because I have all these troubles. And you know, what do you do? I mean, you seem like in good shape. What do you do to keep healthy? What are the exercise we should do as you get older? You know, you don't have the mobility anymore.
Well, there's a lot of stuff that we can do even if we're less mobile. I tell patients you don't have to go outside and run a marathon to stay healthy. A lot of times, lower impact activities such as going on a treadmill or even a bike or an elliptical machine can be very great for joints because you're not having the constant pounding that you get outside while running. And you don't necessarily need to run either. A brisk walk is certainly fine. You know, we should be getting about 150 minutes or 2.5 hours of moderate exercise a week, and that can involve simple walking. A lot of times too, when we need to take pressure off our joints or when we have trouble with our joints, such as people with arthritis, the great thing about living in South Florida is there's always a pool available, and that will take away a lot of the pressure that gravity puts on our joints and allow people to do a lot more exercise.
So walking in a pool is good exercise for knee problems, correct? Or hip problems?
Great exercise. You know, what it does is some of the buoyancy of the water takes a lot of the pressure off of our knees and allows people to do a lot more exercise pain-free than they would on dry land.
How important is your weight relationship to your knee problem or your hip problem? Yeah, guy says, I'm only 20 pounds overweight. Well, that 20 pounds, is that going to affect his knee problems? I know it affected mine. I lost 35 pounds, so my knees feel better.
And that's usually the case, but that's not always the case. But every time we take a step, we put 5 to 7 times our body weight through our knees. Now, if you think of losing 20 or 30 pounds, you know, I always do a calculation for some patients, and that's taking little tons off your knees every single day. If you're supposed to take 10,000 steps or 5,000 steps a day, every time you walk, every pound you lose is taking tons off your knee every single day, and most people find them much more comfortable carrying around less weight.
So again, I recommend if you have any knee problems, you're down in the Broward area, down in Boca Raton area, go and see this young doctor. He's been around this area for 2 years. He's located again at Florida Medical Center. He's in private practice also, doctor? You're in private practice down on your own too?
Yes.
So he can advise you on what to do. During this COVID time, people are afraid to go into a hospital. Do you do any outpatient surgery in outpatient facilities, or is everything in the hospital?
Everything's in the hospital, but we do outpatient procedures there. What we do beforehand is we have people come in a day or two before and get a COVID test. We actually do 2 COVID tests. We do 1 rapid test and we do 1 of the PCR tests to confirm that they do not have COVID. If it's an elective surgery and the patient is found to have COVID, then we say it's elective and then we postpone. If they do not, and all the other patients there are screened, we feel very safe proceeding with surgery.
So it's, you feel right now, if you need a knee, don't hesitate. Don't worry about the COVID disease. Just go in to see the doctor. They'll make sure you're safe. It's in a safe environment. Doctor, telling me I've got to leave, but I got to tell you, it's been a pleasure having you on again. Peter Kaplan is a friend of yours. He'll be calling you, and I know he's looking forward to seeing you again. And again, thank you so much for coming on. You have a happy and healthy holiday. Stay healthy, please, because we need guys like you around. Matter of fact, did you get your shot?
I did. I got mine last Thursday.
Fantastic. We're looking forward to getting ours too. Again, good night, folks. Have a happy and merry holiday. Stay healthy.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.